Saw you last weekend. The number of coronavirus cases in Texas has increased 300%. Everyone expected that to happen. Why? Well, it's simple. More tests were made available in the last 7 days. Right now, Dallas County has the most cases in the state, 55 of them as we put this program together. So we are beginning with Dallas Mayor Eric Johnson on the response here. Good morning to you, and we want to note we're a little farther apart than normal, 6-7 feet for that social distancing. How are you doing?
I'm doing fine, and it's always good to be here, even under these circumstances. It's good to be here.
Thanks for coming in. I want to start with a sentence you wrote in an op-ed a few days ago. This is an important sentence. It was a little farther down. I would maybe pull it up a little bit. Most cases of COVID-19, you wrote, are mild, but the life you save by taking precautions could be that of a loved one. Here's the biggest question I have, and the biggest question that a lot of people have. How long do you expect restrictions to potentially last? I've heard 8 weeks. Is that realistic?
The reality is we just don't know. This is so unprecedented. It's hard to emphasize enough just how different a global pandemic where we don't have the widespread testing to tell us exactly who is currently carrying this virus, how unprecedented that is. We can't really say how long we'll be in this phase of implementing these types of emergency regulations that you're seeing, because we really don't know the full scale of the spread of the virus right now. So it's just as much as people want that certainty, as much as I'd love to be able to provide them that certainty of when, I can just tell you this. We won't be in the circumstances we're in terms of regulations a day or a minute or an hour longer than we have to be. But for right now, without knowing where we are in terms of spread, in terms of community spread, we have to do what we have to do to keep people safe.
Mayor, is this working the way everyone anticipated it to work?
I don't know what people were anticipating, because
well,
again,
as leaders anticipated it to work.
What I mean by that is, again, the unprecedented nature of this. I think the governor has made the right decision in shifting some of this decision making up the chain to the state so that these regulations are more uniform, because what we're trying to achieve is flattening of the curve. And by flattening of the curve, what we mean by that is we don't want there to be a sharp run on our medical community, on our hospital system, because of a sharp uptick in the number of people who become infected with the virus. We want this to be spread out a little bit slower and over time, so that our system can accommodate these cases. So right. I think that what we need then is a more widespread approach to these regulations. We can't have Dallas saying no restaurants except for takeout and delivery, and no bars, and then Frisco or some other cities saying, we'll do whatever, the opposite of that. So yeah, and the governor is necessary.
The governor has stepped in to make that declaration statewide. But let's talk about the economic impact,
sure.
Mayor. Thousands of Texans are getting laid off because of the restrictions. You were in the legislature. Do you think the governor should call a special session? Should the legislature consider rent relief, or some way to delay mortgage payments? I don't know if they actually have the authority to do that, but something to help the people who are currently out of work.
Well, the legislature is the sovereign body of lawmaking in the state of Texas. They can certainly do what they'd like. They could meet in a special session. I don't know if I'd advise them meet in person. I don't know if they have the ability to meet through a video conference like we just tried in Dallas on Wednesday. But certainly some form of economic relief is going to have to come from every level of government that has the ability to provide it. And we can't forget something that's super, super important. The government's money is the people's money. It's tax money. The taxpayers gave it to the government. This is what it's for. So we're not doing anybody any favors. This isn't charity. This is us doing our job. And so the federal government, the state government, and local government all needs to step up to the plate to make sure that these regulations that we've put in place, which are necessary to protect public health, they're going to have an economic impact, and it's our job to cushion the blow on our citizens and our residents.
Let's talk about that for a moment. You guys are all over the public health emergency side of it, but the economic toll is likely going to be far worse, as you know, than the health toll of this. What kind of projections, if any, have you seen about the Dallas economy?
Well, I have not seen any concrete numbers put together yet, because again, my role in an emergency, which is what we are in right now, we are literally under a local state of emergency, is to lead the city's disaster response. And I can tell you, I spend more time in the Situation Room at City Hall, in the Emergency Operations Center, and on the phone with White House staff, with government staff, the governor's office, and with, of course, our county, which is our local health authority, talking about literally how to make sure that this doesn't cause an unnecessary loss of life. And I've created 2 committees of the city council to specifically deal with already starting the process of cushioning the blow economically. So we are doing what we can, but what that amounts to right now for me is a city council committee that's being chaired by Casey Thomas, the councilman, to focus on the economic impacts. And we have another committee that's focusing on the regulatory side of things and making sure that that the regulations that we're putting in place are being followed, so this won't be a big waste.
Well, are there ideas that you're hearing from either of these 2 committees on how to cushion the blow to these citizens?
They haven't met yet.
Okay.
They are about to start meeting, but I definitely have heard from the private sector, and I think this is a great idea. We need to start figuring out places where we can shift affected industries like the service industry into less affected industry. So there are places that maybe have capacity to hire some of the folks who are being directly impacted. Finding them work.
I want to ask you a last question in the final moments here too. California and New York have now implemented essentially statewide lockdowns. Should Texas follow suit?
I mean, that's for the governor to decide based on, and this is what I would encourage the governor to do.
Do you think he should?
I think the governor should do what the public health authority that he has, he's listening to Dr. Hellerstedt. I think he should listen to him, not pay attention to, because there are voices in all of our ears right now, the elected leaders. There are folks who are saying we're not doing enough and we're not acting boldly enough. And there are people who are saying we've acted too rashly and been over aggressive and are overreacting. I'm listening to public health officials every time I make a decision, and I would encourage him to do the same thing.
All right, Dallas Mayor Eric Johnson, stay healthy, and we appreciate your time.
Thank you. You do the same.
Appreciate it.